welcome. Thank you for making the time to join us today for the fourth in our series of webinars on COVID-19 and detention. This webinar, as you can see from the title, is about immigration detention and COVID-19. And this is going to be co-facilitated by myself. I'm Stuart, the head of the Justice Health Unit at University of Melbourne, and Louise Southalan, who wears many hats. But one of those is we're lucky enough to have Louise as part of the Justice Health Unit at the University of Melbourne as well. So I want to start it. For those of you who are in Australia, you're probably aware that this is NAIDOC week. It's a week where there are opportunities for us to recognise the traditional owners of the land that we all live on in Australia. And it's traditional for us to acknowledge those traditional owners at the start of meetings like this. So I'd like to acknowledge the traditional owners of the land that I'm on at the moment, the land of the Bunurong people of the Kulin Nation, and pay respects to their elders, past, present, and emerging. And for those of you on Indigenous lands elsewhere, I'd invite you to do the same and just recognise the traditional owners of the land that you're on. So I'm not going to do much talking tonight because you're here to hear from an amazing lineup of speakers, but very quickly, some acknowledgements. So we have some funding support for this webinar series from the Centre for Health Equity at the University of Melbourne, and we'd like to thank them for that support. These webinars are a product, I suppose, of the Justice Health Unit at the University of Melbourne. And as you can see from the list of people there, it's been the work of many people to pull this together. Louise Southalan, who's on the webinar tonight with us, Claire Keane, Lindsay Pearce, Elena Vasey, and Claire Chiminello, who's also working away in the background to make sure everything goes well. And technical support from Tihin, who's kindly supporting this in the background as well, and Lily May from University of Melbourne. So thank you to all those people. As I said, this is a series of 6 webinars on the theme of COVID-19 and various forms of detention, or different lenses on detention. The aim of the series as a whole is to understand the policy and operational responses to COVID-19 in places of detention so far. It's obviously a rapidly evolving space, and to identify what's been missing from those responses. What are some of the things that we can learn? And from that, we hope that we can start to develop some recommendations for what we think might be a comprehensive, sustainable, and probably necessarily cross-governmental response to COVID-19 in places of detention. So there are 6 webinars. The first 3 have been completed. The first was a global overview, and we were fortunate to have speakers from WHO, ICRC, and elsewhere. The second on decarceration, the third on rights, accountability, information, and standards. And those 3 webinars, along with the slides from the presenters, are all available from links on the Justice Health Unit website, and I invite anybody who's interested in those topics to access those. They're freely available. This one today is on immigration detention. For those of you who are interested, we have 2 more to follow. The 5th on Australasian issues, and the last one, again, taking a broader lens, thinking internationally about next steps for policy, advocacy, funding, and research. So please stay tuned for those. So it's my absolute pleasure to introduce our really outstanding lineup of speakers for today's webinar. Those 4 speakers who are all shown here, I'll just quickly mention Vivienne Chew, Acting Director of the International Detention Coalition, Dr. Mitsuyoshi Morita, who's a healthcare and detention specialist with the ICRC in Geneva, Dr. Mark Travassos, who's a pediatrician and infectious diseases specialist in the Centre for Vaccine Development and Global Health, and Director of Global Health Track in the Department of Pediatrics at the University of Maryland School of Medicine, and Joanna Josephs, who's the General Manager at the Centre for Asylum Seekers, Refugees and Detainees. So thank you very much to all of our presenters. So the sequence of events for tonight is that I'll briefly introduce each of our speakers, and then they will speak for roughly 8 minutes, or quite a short presentation. And then during that time, I'll invite everybody who's listening in, if you have any comments or questions or observations, to type those into the Q&A. If there are any absolutely burning questions or comments, we might address those at the time. But by and large, what we're hoping to do is to have our 4 presenters speak, And at that point, when the full presentations are done, I'll hand over to Louise, who will be compiling all of the comments and questions in the Q&A, and Louise will facilitate a discussion between yourselves, the audience, and our panellists, and among our panellists as well. Please feel free to comment and question. We invite you to participate as much as possible. This is being recorded and will be available on YouTube, the University of Melbourne's YouTube channel after this. Okay, with no further ado, I'll move on to our first speaker, and apologies for looking away from the camera. I'm looking at the bio. Our first speaker for tonight is Vivienne Chew, who's the acting co-director of the International Detention Coalition. Vivienne joined IDC in the Asia Pacific Regional Coordinator in 2012, and she's currently the acting co-director. She's worked since 2009 with refugee and asylum-seeking communities, predominantly in countries of first asylum. During that time, she successfully established and managed refugee-led legal aid programs for asylum access in Thailand and Tanzania. She also served as chair of the Asia Pacific Refugee Rights Network Immigration Detention Working Group from 2014 to 18. Vivienne has an amazing track record, has done an incredible number of things, and rather than listening to me, I'll now hand over to Vivienne to give her presentation. Thank you.
Thank you so much, Stuart. Thank you as well to Louise and Claire and the Justice Health Unit for the invitation to participate in this really important discussion. So for those of you who aren't familiar with the International Detention Coalition, we are a global network of over 400 organizations and individuals in more than 100 countries. And we work to secure the human rights of people who have been impacted by, as well as at risk of immigration detention. So at the outset, I wanted to quickly highlight two recent IDC publications. So Stuart, if you could move to the next slide, please. So these two publications really speak to the subject matter of this webinar. And the first is this one here, which is COVID-19 Impacts on Immigration Detention, Global Responses. This is essentially a collaboration between IDC and Hadri at the University of Western Sydney. And it really features rich contributions from members and as well as other civil society organizations and academia from 20 countries. And these contributions really speak about the different ways in which COVID-19 has impacted people in immigration detention or who are at risk of detention. So the second publication, next slide please, is a briefing note that we recently released, and it captures some of the promising developments that we've seen in relation to the use of alternatives to immigration detention during the pandemic. So much of what I'll speak about today really draws from these two publications, including the pieces written by contributors to our Global Responses report. So please do take a look at them on our website. So moving to the next slide, we've been asked to just identify a number of challenges and issues over the past year that we've seen in relation to COVID-19 and immigration detention. And we've seen a raft of issues. And of course, many of these already existed prior to the pandemic, but were really exacerbated and amplified by the pandemic. Obviously, there isn't time to cover them all, but these are some of the key ones that we've seen. And I think a really critical point here is that even prior to the outbreak of COVID-19, many countries had been relying very heavily on immigration detention as a migration management tool, with many states having a significant detention infrastructure and really using detention as a measure of first resort. And that was the situation in many countries as the pandemic unfolded. In addition to the detention facilities that were already in operation, in some cases, we actually saw the creation, repurposing of facilities to create new places or new forms of detention, were then used to quarantine refugees, migrants, and stateless persons. Some places actually became de facto detention sites. So for example, in Singapore, migrant dormitories where foreign workers live became places of de facto detention after there were outbreaks of COVID-19 amongst the migrant community. The migrant workers were then confined in their dormitories for approximately 6 months, with some of them not even allowed out of their shared rooms. Another significant issue, obviously, was that of conditions in detention, and I won't speak too much about this given the expertise of the other speakers on this panel. Suffice to say that in many countries, conditions in immigration detention centers are appalling, making effective social distancing impossible. and also placing people therefore at increased risk of contracting the virus. Unsurprisingly, we have seen outbreaks of the virus in immigration facilities across a number of countries, including in the US, in Malaysia, and in Thailand. And what more, in some countries, we also saw continued enforcement operations. And in Malaysia, for example, thousands of people, including women and children, were arrested and detained in May of this year at the height of the first wave of infections in the country. And this had the effect of not just putting more pressure on already overcrowded detention facilities, but also on public health, as the enforcement activities not only drove people underground for fear of being arrested, but also likely contributed to the outbreak of COVID in detention facilities in Malaysia. Of course, there was also closing of access to detention facilities in many countries, which not only ended social visits, but also impacted the delivery of critical services like legal aid and the ability of community detention visitors and monitors to carry out their work. In the UK, NGOs reported higher levels of anxiety, stress, and self-harm among detainees. This closing of access to detention has also, of course, made it more difficult to even understand the extent to which COVID-19 had reached inside detention, with governments in some cases failing to communicate effectively or transparently. We've also seen suspension and delays in legal and administrative processes, resulting in less judicial oversight over the detention process, and the closure of borders, which of course led to the increase in the risk of indefinite or prolonged detention. And lastly, I think really critically was just this significant rise in xenophobia and discrimination against refugee, migrant, and stateless communities all over the world. And in Tunisia, for example, NGOs reported a marked increase in discrimination, particularly towards Black migrants. And in the Asia-Pac region, we saw a rise in anti-Rohingya hate speech in several countries. And in these cases, the narrative was similar, that refugees and migrants are associated with COVID-19 and they were responsible for its spread. And this in turn enabled some states to justify harsh enforcement operations and to more easily deflect criticism over outbreaks of COVID-19. So moving on to the next slide, in terms of some of the more positive things, the more opportunities that we've actually seen arise as a result of the pandemic. And one was clearly just the possibilities for engagement around public health. And, just the acknowledgement that detention can exacerbate the risk factors for COVID-19 presented public health as a new avenue for engaging state authorities over the harms caused by immigration detention. Really the point that health in detention centers is public health, that COVID-19 not only endangers detainees, but also guards, staff, and other visitors that come in and out of the center. I think by far the greatest opportunity we've seen is just dialogue, the mobilization, and the coordination that's come out of the past few months. We've seen incredible mobilization among civil society organizations and individuals, doctors, lawyers, detainees themselves, and others to challenge the use of immigration detention. We've seen this happen in countries such as Australia and the US, Hong Kong and others. And that picture there is a picture of a candlelight vigil that was held by a group in Hong Kong that really highlighted the use of detention, what was happening in detention during the pandemic. We've also seen greater collaboration between civil society and government and public authorities. In Tunisia, for example, an unprecedented level of collaboration to respond to migrants in need, including through initiatives that were led by the Ministry of Human Rights. We've also seen large-scale releases on an unprecedented level again, and these have really happened in countries like Spain, where all detention centers were emptied and closed, and also large-scale releases in the UK and Japan. We saw moratoriums on arrest and detention in countries like Ukraine, Portugal, and Poland, and then the relaxation or simplification of reporting of conditions such as reporting or designated residence requirements. And in many of these cases, governments used previously underutilized laws and policies, and they quickly deployed these to enable releases or moratoriums to happen. Moving to the next slide, I think in terms of looking at, given there were all these positive developments, what was missing? And I think, for us at the IDC, a real critical element that was missing was that of rights-based alternatives to detention. These weren't entirely missing. Some of the responses were in the right direction. For example, in some countries, people released from detention or who were at risk of detention were provided with support from government agencies. meet their fundamental needs and realize their rights. However, in most instances, detainees were released, they weren't given documentation or support, and they were left in destitution with no access to national social security systems. So what really has been missing is this rights-based approach to migration governance. And here I've highlighted the IDC's community assessment and placement model, which unpacks what the different elements are of a rights-based community-centered ATD model. I don't have time to go into it in detail, but I have put the link down there for anyone who would want to learn more about how to use this tool. So racing ahead to what lies ahead, the next slide. I think that what we'd like to see happen now in the next year is at the very first step to see a release of vulnerable groups from detention, and that those that remain in detention, that we ensure conditions are improved and that they do meet international standards. I think what is really critical for us is to make sure that we do not see a return to the status quo. The pandemic has shown us that there is a critical need to move away from migration governance frameworks that prioritize detention. And we do believe that rights-based alternatives to detention are a means for this to happen. In countries where we have seen positive developments, like in Spain, there's now a real concern that governments are returning to business as usual. And they are ignoring the opportunity to consider how this historically low numbers of people in detention can be maintained. And we really want to see concrete steps being taken to avoid this return to business as usual, and instead of focus on how we strengthen and expand rights-based alternatives, part of the reform of our migration governance systems. So how do we do that? I think the critical first step will be to really capture learnings through in-depth research on the different forms of alternatives and other measures that were used across multiple countries and what impacts they had on individuals, communities, and on public health. So the briefing note that I referred to that we just released is just the beginning of that process, but there really is a need for more in-depth longitudinal and comparative research on this. We also need to capture, reflect, and utilize we need to capture, reflect upon, as well as utilize the learnings from challenges, concerns, and to answer this question, if approaches such as large-scale releases, moratoriums, as well as relaxation of conditions can be utilized and may not be continued, and if they can be sustained, broadened, how can we sustain them, broaden, and scale them up beyond the current pandemic? I think this learning and this reflection really needs to take place collaboratively between multiple levels of government, between civil society, academic institutions, and UN agencies working together. And it really needs to involve people who have lived experience of immigration. And I think at this stage, it's also really important to take stock of what already exists. In many countries, we do have NGOs who have the capabilities, the expertise, and the willingness to implement alternatives, and many of them actually already doing so. I think I'm running out of time here, and I've put in these three very large, broad things that I think need to happen in the next 3 years and beyond. These really center on addressing the structural issues that exist within migration governance systems, and really to dismantle the detention infrastructure, including through the use of rights-based ATD. They're obviously really big pieces of work with many complex components, and they will take much more than 3 years. But I think this is the right time to start. So I will stop there. Thank you.
Thanks very much, Vivienne. That was a terrific presentation. I appreciated the focus on there being room for hope, and you've articulated some of the steps that we need to take to move into positive directions. I'm sure we'll come back to some of those points in the discussion at the end. I might now, though, move on to our second speaker, and it's a real pleasure to introduce Dr. Mitsuyoshi Morita from the International Committee of the Red Cross in Geneva. Dr. Morita is the healthcare and detention specialist with the ICRC, which operates worldwide, helping people affected by conflict and armed violence and promoting the laws that protect victims of war. Since 2015, he has joined ICRC's efforts to secure humane treatment and conditions of detention for all detainees, regardless of the reasons for their arrest and detention. He has worked with detention systems in Central America and Southeast Asia. Dr. Morita, over to you.
Hello, everybody. My name is Mitsu. I'm a public health physician, and I'm the healthcare and detention specialist working here at the headquarters in Geneva, Switzerland. My role is to support technically the health and detention activities in Central and South America and Europe. For me, it's really an honor to be invited by the Justice Health Unit of the University of Melbourne to be part of this webinar and with such prominent panelists. I believe that majority of you already have heard of the ICRC. I would like just to take this opportunity, highlight that the International Committee of the Red Cross is an independent, neutral organization ensuring humanitarian protection and assistance for victims of war and armed violence. It takes actions in response to emergencies and promotes respect for international humanitarian law and its implementation in national law. ICRC has a wide range of activity, and one of them is to really secure humane treatment and conditions of detention for all detainees, regardless of reasons of their arrest and detention. ICRC also seeks to alleviate the suffering of the families of the detainees, particularly by restoring the communication between detainees and their relatives. We do it within a multidisciplinary approach, intervening in different levels from the place of detention up to higher levels of governments. Well, we are all affected by the pandemic in different ways, depending where we live, lifestyle, work, family, and so forth. We knew that a pandemic could occur soon. Knowledge and experience are different. And now we are learning on a daily basis how to live with this continuous challenge. Also, we have known that by its specific characteristics, place of detention and the population living there and the staff working there will be facing a significant risk and vulnerability if such pandemic occurs. I have been mentioning the term place of detention and detainees in general intentionally, just because whatever the reason of the arrest and whatever is the process of detainees needs to face, it is a state responsibility, a duty of care to address the needs of the detained population, be a jail, a prison, or an immigration center. And this list is not exhaustive. I think there are unique factors pertaining to people remanded in custody by a judicial authority or deprived of their liberty following conviction. First, the detaining authority has to assume a duty of care for them. That is a comprehensive obligation to meet at least their basic needs. Prisoners or detainees are entirely dependent on the staff and the detention centers for all aspects of daily lives, as well as for protection and safety. And third, detainees retain all human rights other than their freedom. Their right to health is in no way diminished by their detention. State must act to provide timely and quality service to protect, promote, increase the resilience and provide medical care of the people living and working in the place of detention. And this includes immigration centers. Places of detention surely have common characteristics, but they can be very different as well. Certainly, immigration center presents its specific challenges. We cannot generalize a very complex issue, but it's not uncommon to observe that the immigration center can be less prepared, less equipped in terms of know-how, resources, compared to prisons in the same context, to provide the four components that I have just mentioned: health protection, health promotion, increased health resilience, and medical care. It is known that the prison health system lack or present difficulties to properly integrate its health services with the national health systems, with potential negative consequences for the health of the detained population. And this can be enhanced in the immigration health services. Lack of clear laws, policies, standard operational procedures, government admin structures, resources. I'm referring to issues that can be reflected into the 6 building blocks of the WHO health system framework, that they may not be developed in accordance with the dynamic, complex, changing health needs of detained immigrants. In practice, for example, it can mean that these immigration centers may not be prepared to house adequately the increasing number of population, as mentioned before. Its health services may not be adequate for the diversity of the population. It can be understaffed, or staff are not prepared to deal with such complex situation. The means of health may not be in conditions to provide healthcare for them. Maybe they are overloaded with the COVID response and nationwide. And in some contexts, private medical services can be hired to provide in its place, which can have a different standards from the Ministry of Health. Regarding response to COVID, I think there are questions that have different answers for different contexts. For example, is the place of detention considering the national emergency response? Are immigration centers part of this response? What is the practical meaning of being part of the national plan? Resources are needed. For example, testing. We don't talk only about availability of test kits, but coordination with laboratories, for example. Infrastructure. If we talk about quarantine, medical isolation, training of staff, referrals to hospital, etc. So important question is, are the detained immigrants considered in these competing needs that all countries are facing? It's really an important question that authorities and all of us, we need to address this. I would like to mention quickly about vulnerability. Many studies and knowledge about vulnerable groups in prisons, and this shall be applicable to the immigration centers. Women, children, elderly, disabilities, how their needs are addressed, how their health is protected in this pandemic time. If the immigration centers are less prepared, are these vulnerabilities enhanced? This must be considered. Well, being an immigration center, there are different languages, there are different cultures. There is a high risk of loss in translation, let's say, between everybody. It's not uncommon to encounter detainees that do not understand their own medical treatment. They are not able to ask, they are not able to be explained. Staff health does not how to communicate with them, to work with their clients. Just think about health promotion, prevention activities. So I've been talking, and then imagine the tension that it comes with this loss in translation, the tension. And then we have seen such examples in different places, such as in Greece, for example, with the fire in the Moria camp. I've been talking about challenges, but I really share with my colleague with the President's presentation with Vivienne, that this is an opportunity for the society. This pandemic is merely exposing all the systemic difficulties and challenges that detaining authorities have been facing for a long time. This is time to acknowledge that health of the place of detention, including immigration centers, are part of the public health of the society. We cannot deal with immigration centers separated from the others. In the short term, we really need to encourage all concerned actors, ministries of health, justice, civil societies, academia, to come together and address the health of detainees as part of the national response. In the long term, there is a need to rethink if the current government leadership is adequate, prepared to provide a timely and quality response that address complex challenges, and if this benefits all the people in the society. And I think we need hope. We are seeing that looking at the society as a fragmented group is not helping at all. We live in the same country, we live in the same context, continent, and the same planet, and we need to work together. So I'd like to finish with these words, Stuart. Thank you.
Thank you very much, Mitsuyoshi. That was really a lot of what you said resonated with me, and certainly the notion that this is an opportunity for us to create systemic change that, by the sounds of it, is long overdue. And I'm sure that's something we'll come back to in the discussion. I will now move across to our third presenter, Dr. Mark Travassos. So Dr. Travassos is a pediatrician and infectious disease specialist within the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. He's director of the Global Health Track for the Department of Pediatrics at the University of Maryland School of Medicine. His work focuses on the intersection of infectious diseases and human rights, as well as the pathogenesis and vulnerability to cerebral malaria and other forms of severe malaria in children in sub-Saharan Africa. Dr. Travassos, over to you.
Great, thanks very much, Stuart, and thank you for the invitation to join the panel today. So I'm going to talk a little bit about the situation in the United States with COVID-19 and immigration detention centers, and the challenges that we have been facing and what's ahead. So if we could move to the next slide. The immigration detention centers in the United States process a large number of individuals each year. Last year, it was over 500,000 detainees that are processed really by the Immigration and Customs Enforcement wing of the United States federal government. And one of the challenges under the Trump administration has been the anti-immigration policy, which has really been led by one individual, Stephen Miller, who's the senior presidential advisor, an immigration hardliner, and has been known to have white nationalist sympathies that have come out recently in the news. Under Miller's immigration policy, it's been particularly unusual because family separation and infections in detention centers have been used as deterrents to immigration. And so this has been really kind of a malevolent approach to immigration that I'd like to kind of focus on to begin with. So if we move to the next slide, we'll just talk a little bit about first the situation before COVID-19 in the United States, which really was emblematic in how one detainee, an 8-year-old boy named Felipe Alonso Gomez, was treated. So prior to 2018, really no child had died in US Border Patrol custody, despite the large numbers of children and families who had been detained over the decades. But about 1 week prior to Christmas in 2018, Felipe was apprehended with his father crossing the border into Texas from Mexico. And while in detention, on his 6th day of detention, he developed a cough and some fatigue. And he was taken to a health center that was nearby, where there were actually no pediatricians or pediatric expertise available. He was subsequently diagnosed with influenza, but did not receive influenza medication and was brought back to Border Patrol facilities. Later that day, he developed lethargy and actually was brought back to the same facility and passed away before midnight, actually, on Christmas Eve. One of the remarkable things that came out in the analysis following that was that, given the incubation period of influenza, Felipe had actually contracted influenza within the detention center itself. He had arrived at the detention center in good health and really had come to contract this illness under US care. And it's a real important point that I think Mitsuyoshi makes about this idea that, when these federal authorities assume care of these individuals, there's this duty of care that's present and a real failure in the care of Felipe. So if we move to the next slide, since that period in late 2018, there have actually been 7 children who have died in US custody from infections that were either contracted or mismanaged while under the responsibility of the US government. And investigations into their care have shown real significant delays in medical attention and supervision, inadequate medical expertise in their care themselves, and that there was a setup for these children to really become infected in crowded detention centers where there was very poor sanitation. So if we can move to the next slide. Since then, we've seen under the Trump administration that there have been outbreaks of infectious diseases in US detention facilities. Prior to COVID, that included, as you can kind of see in these graphs, outbreaks of influenza, of chickenpox and varicella, and mumps. And this has resulted in thousands of detainees being quarantined while in detention centers. And remarkably, the Homeland Security lawyers from the federal government have actually argued that migrant children do not have the right to basic sanitation during this time. And what I think is also notable about these infections is that they are preventable with the use of vaccines. However, the federal government, including Immigrations and Customs Enforcement, has actually refused to provide immunizations to detainees, including to children. So preventable illnesses, unfortunately, have not been prevented with the use of vaccination. If we could move to the next slide. So with COVID-19 in immigration detention centers, we've seen, unfortunately, since March that there have been thousands of cases in detention facilities across the United States. In terms of the testing that's been taking place, at times the testing positivity rate, the numbers of individuals who have actually been positive for SARS-CoV-2, has exceeded 50%, which really shows a remarkable spread of COVID-19 in our facilities and likely inadequate testing of individuals. There have been multiple deaths from COVID-19, unfortunately, and rulings by federal judges ordering release of children and families has actually been ignored by the federal government. This has really been kind of a remarkable situation. And when we've analyzed the policies and science behind the rules actually governing how to deal with COVID-19 in detention centers, we found that federal authorities are not actually following the recommendations put forth by the Centers for Disease Control and Prevention. There's limited and poor sanitation in these facilities, and it's impossible to actually achieve adequate social distancing for detainees. And at the same time, detainees who are showing some symptoms of respiratory infections are being grouped together. So individuals who don't actually have COVID-19 are being exposed to those who do. So this has obviously been an alarming situation, and we've seen even in some facilities where children are being detained that unfortunately COVID-19 has really spread throughout this situation. So if we move to the next slide, we can see that over the past few months, the number of cases of COVID-19 in federal detention centers has really skyrocketed, while across the nation, the levels have been fairly constant up until about August. So there's been a real failure to control COVID-19 in United States detention centers. So where do we go from here? And I'll just move to my last slide here. And there are some immediate priorities, and perhaps the most hopeful point here is really that there has been and there will be in January a change in the federal government under the Biden-Harris administration. And this, we hope, will represent a fundamental alteration in the structure and approach to immigration. This change in tone could result in large-scale transformations of how we approach COVID-19 in detention centers. And importantly, we have to have a few things to be considered. For one thing, we need improved testing for SARS-CoV-2 in these detention centers. There must be much widespread testing and a much lower threshold to do testing in detainees. There has to be also an increase in transparency. This is a major issue, and right now medical expertise, physicians who are volunteering to provide their efforts and expertise are being denied access to detention centers. And while data for federal detainees in ICE is publicly available, information on children in detention centers has been limited, and that data is simply not available and being presented to the public. So with this, we really need to improve and account for the ability for individuals who are being detained to have social distancing within detention centers and access to appropriate sanitation. In the long term, we really need to rethink our approach to detention in the United States and really consider whether we can close centers and release individuals who are currently being detained in the light of the pandemic that has been ongoing. I think one of the major issues in the upcoming year will really be vaccine access. As we move towards developing an effective vaccine for COVID-19, immigrant detainees really need to be considered a priority population for vaccination. And this is a really important designation to provide them some access to effective medical care when they are one of our most vulnerable populations. And one of the major issues that has been leading to a lack of transparency as well is the fact that many of these detainees are in private facilities that the federal government contracts to. So to really have increased transparency, we really need to eliminate this kind of outsourcing so that the federal government is directly responsible for their care and can provide ready access to information about their care. So, so these are some of the major issues that are there, and I really want to echo some of the sentiments provided by both Mitsuyoshi and also Vivienne about the importance of optimism, and especially in the United States, I think we're hopefully starting to look towards more of an optimistic tone in the time to come. So, thank you.
Thanks very much, Mark. I think some of the data you're presenting there are very concerning, and I really appreciated you finding room for optimism and again, trying to articulate a path forward to achieve a better outcome for young people in detention. If there are no burning questions, I might move on to our fourth and final speaker for tonight's webinar, who's Joanna Josephs. Joanna is the General Manager of the Centre for Asylum Seekers, Refugees and Detainees, which provides case management, emergency relief and volunteer support for people from refugee and asylum seeker backgrounds in Western Australia. Since 2015, Joanna has led a detention visiting program, which has empowered volunteers to visit more than 350 people seeking asylum in immigration detention centres to provide social support and to advocate for rights, including safety, legal assistance and medical care in detention. CARAD also advocates at an individual and systemic level for an end to immigration detention and provides practical assistance to those who are released into the community. It's a great pleasure to welcome you to speak with us. Joanna, over to you.
Thank you very much. And thank you to the other panelists for sharing your insights. So I'm coming to you from Whadjuk Noongar country here in Perth, Western Australia, and sharing some of the insights from our organisation, having led a volunteer group and been part of personally visiting detention centres over the last 5 years. So to provide some context about immigration detention in Australia, we have a number of different types of immigration detention. So first we have closed immigration detention facilities on the mainland of Australia. And those would have people from asylum seeker backgrounds, refugee backgrounds, as well as people who've had visas cancelled, usually for due to criminal convictions under certain sections of our law, or people who've overstayed their visas. So there are about 1,500 people in mainland detention facilities across Australia. And of those, CARAD is supporting those people who are from refugee and asylum seeker backgrounds. So unfortunately, we still have the policy in Australia that people seeking asylum who've arrived without a valid visa are subject to mandatory and indefinite detention. So we have people in detention now who arrived to Australia by boat who've been in detention for more than 10 years straight. We also have had a policy whereby people who arrived to Australia by boat after 2013 were sent to offshore processing. So that occurs on the island nation of Nauru and also on Manus Island, which is part of Papua New Guinea. Those people's refugee status claims are determined by the governments of those countries. At present, there are still about 200 people stranded on Nauru and Manus Island, but about 1,000 people have been brought to Australia because owing to significant mental and physical health conditions that couldn't be treated offshore. Of those people, there are about 200 people who are held in what's called alternative places of detention, which is actually usually a hotel room. So at the moment, there would be 2 to 3 people in a hotel room in various places in Australia. Others were brought to the mainland and put in community detention. And what that means is the government assigns you accommodation, so where you have to live. People don't have visas which allow them to work, and they receive a very small stipend from the government at the moment. And there are about 750 people who are in community detention, but we'll come back to that. Our main experience has been visiting people in detention facility, which is about an hour and a half outside Perth. There are about 350 people in this facility, of which about 82 are from asylum seeker backgrounds. When COVID-19 hit, I suppose, visiting to the centre was immediately suspended. So that's been since March of this year. There was a huge amount of panic and concern from people seeking asylum and all detainees in the centres. As raised by previous panellists, it's near impossible to practice social distancing in overcrowded detention centres. There are huge numbers of staff turnover, there is inadequate protective equipment and inadequate training about preventing the spread of infectious disease within the centre. And there were already existing concerns with significant mental and physical health conditions, inadequate provision of mental and physical health treatment within the facilities, and just an incredibly vulnerable population. There was a lot of panic within the centre and misinformation going on. And part of this was also due to the fact there was a lot of transfers that happened from between the centres. So where I'm located in Western Australia, we've supposedly had a hard border closure since March, which applies to virtually everyone, except that a large number of people seeking asylum were brought from centres in Sydney and Melbourne over to Perth, to our centre in Yonge Hill without quarantining and things like that, which also added to a lot of concerns within the detainee population. All these transfers and in fact an increase in the number of people being held in immigration detention during COVID resulted in the Christmas Island Detention Centre being reopened. So this is a little island off the coast of Australia with a detention facility which is expected to hold up to 250 detainees. Now, the government has said that those people would not be refugees and asylum seekers, but that is in fact incorrect, as people from refugee backgrounds who have their visa cancelled are being held in Christmas Island Detention Centre as they're considered as a different sort of cohort of people. The facility there is incredibly remote. It has really bad communication. So for example, one person that we've been supporting, he was relocated to Christmas Island about 3 or 4 weeks before a really important court date. He was expected to go ahead with the court date. It was incredibly hard for legal representatives to get a hold of him. We had to personally send him a phone, charge it up, load it up with credit. And when he had his legal hearing, the video link kept dropping out. The interpreters couldn't understand him with this audio quality, and he was severely disadvantaged for the fact that he's in a remote facility and transferred with no notice. Not to mention the fact that his physical and mental health was considered he was a very vulnerable person prior to transfer, and that he would not be able to receive adequate care. Pleased to report he actually got released following that court hearing. So a little bit of positivity there. But also to put in context, the reopening of Christmas Island Detention Centre has cost $55.6 million because it is so incredibly remote and hard to staff. So there was a lot of lobbying for people to be released from detention during COVID. And in fact, there were some legal challenges. But as I mentioned, in fact, the overall numbers of people detained have gone up. And that's because the Australian government detains people on all types of visas who've had criminal convictions under Section 501 of our Migration Act. So it's actually increased. But of the few who were released, I wanted to mention it because what happened when people were released was that they were released with nothing into the community during a lockdown. So I personally met with one person who was released from the Yonge Hill facility. He was placed in a backpackers in Perth. This was during the height of our lockdown with nothing, backpacker accommodation for 2 weeks, but no money. And they're given work rights on their bridging visas, but you're not going to be able to realistically get a job in the middle of a lockdown. And the unemployment rates for people seeking asylum are expected to jump to 42% during the post-COVID recession. So we have real concerns for the vulnerability of people who are being released with no accommodation, no income, no access to healthcare, and no support to get connected to things like Medicare so that they can get appropriate medical treatment on release. Similarly, the government has made moves to release people at the moment from community detention. As I mentioned, people who are being held in community detention are those who were originally held on Manus Island and Nauru. They were brought to Australia for medical treatment, and some have been held in community detention for up to 7 years. We're now working with families who are being given 3 weeks notice of their release. So what that means in practice is they're told they're going to need to leave their accommodation within 3 weeks, and their stipend of government funded assistance, financial assistance, will finish in 3 weeks. They will have the right to work, but they have never been allowed to work a day that they have been in Australia for years on end. So again, we are really concerned for the vulnerability of people who are being released. We applaud releases, but we acknowledge that it is really important that people continue to be able to have an access to a safety net once they're in the community. I think it's really important to note the type of legislation that governments also push through during times of crisis. At the moment, during the COVID months, there was an amendment to the Migration Act put forward, which would have made it easier for mobile phones to be removed from people in immigration detention. As I mentioned, visiting has been suspended since March, and so the only connection that people in immigration detention facilities have had is via their smartphones, and this move would have removed them essentially. Now, the Department of Home Affairs or Immigration has made $20 credit extra available per week to detainees to maintain connection, whilst simultaneously moving to be able to remove phones more easily. And also of note is that they don't provide any of the phones. So in fact, our organisation has been distributing more than 160 of them in the last 2 years to maintain that connectivity. There is another amendment to the Migration Act that will go through government, which would strengthen the character test, which is the piece of legislation which enables visas to be cancelled and people to be detained based on criminal charges or affiliations. If this goes through, it's expected that we could have a 4-fold increase in the number of people detained under character issues across Australia. And for people who are on permanent protection visas, having been found to be owed protection, if their visa gets cancelled and they're placed in immigration detention, they are not able to be returned to their country of origin via deportation. So they actually face indefinite detention in Australia. It's a legal loophole that has caught refugee and asylum seeker people for years in detention. We've seen people who've had protection visas cancelled who may have spent less than a year in prison and have now spent an additional 5 years in immigration detention following their prison sentence, as they can't legally have a pathway to being allowed back into the community. Going forward, the federal budget has been announced. We will have a 5,000 person reduction in our humanitarian intake being proposed, which would save $911 million over 4 years. But the cost of offshore detention in this year alone is looking at $1.9 billion. And the support for people who are from asylum seeker backgrounds currently in the community, the financial support has been reduced by 86% in the last 4 years in Australia. So we'll be looking at significant reductions in the support available to people when they're released. As I mentioned, there has been significant, sorry, my cat's trying to jump on my screen. There has been a huge amount of community support for people to be released from detention. We've seen extremely creative and ongoing protests. Of note of the protests going on outside the hotel detention centres and the actions of people seeking asylum who've been held in detention to protest themselves for their rights has been incredibly inspirational as a sense of community mobilisation, that they are speaking out against the abhorrent treatment that they've been facing. It's been a huge call to highlight the inequities of people in our community. They've been moved to create safety nets for Australian citizens, but people on temporary visas and asylum seekers have been completely left out of those safety nets that have been created. Our priorities looking forward are for systemic change. We need to end the mandatory indefinite detention of people seeking asylum in Australia who've arrived with invalid visas, and create a system that's fair, it's time effective, and it respects people's rights. We are still not able to visit people in detention since March this year. We haven't had a case of community transmission of COVID-19 in Western Australia for 700 days. Prisons have been open for months for people to visit, but immigration detention facilities have not reopened. Indications are that they won't be able to reopen until every centre across Australia can open simultaneously. So we have no telling of when that is. So for people who've been in detention without their families and community supports for up to 10 years now, we have serious concerns for their ongoing well-being with this level of isolation, and a huge amount of concern for what should happen if the situation with COVID becomes worse than it did enter the centre. So I'll leave it there, and thanks again for the opportunity to present.
Thanks very much, Joanna. Again, you've covered a lot of ground there, and there's a lot of points that we can pick up on, and your passion for changing some of these things is apparent, and thank you very much for sharing that with us. I might hand over at this point to Louise, who I think I can see has been taking some notes and also having a look at some of the comments and questions in the Q&A. Over to you, Louise, and for people listening in, please continue to add your comments or questions. We would love to hear from you.
Thanks, Stuart, and thank you very much to all of our presenters. Really interesting and thought-provoking and thoughtful presentations. And thanks also for people who have started seeing through questions. They're all good. I just wanted to ask an opening question for all of you. There's obviously some really troubling examples you've given about some of the really difficult impacts and hardships on people in immigration detention that they're experiencing as part of the pandemic. I'm wondering, what do you think administrators of detention centres can do when they're operating in a situation of quite restrictive legislation or restrictive administrative frameworks? What can they do? Have you seen examples of what they can do, or do you have ideas about what they could do to lessen the impacts on people in immigration detention? For example, to lessen the mental health impacts or the impacts of lack of access to family that are going along with the responses to the pandemic. Are you seeing practical solutions that they can do it at facility level? Perhaps I'll ask Vivienne first. Have you seen anything like that?
I have not. I'm just thinking in terms of, the countries which I'm most familiar with in Southeast Asia, for example. I think that the issue is that often the legal frameworks don't really permit much else. And so you do have people who head detention centers and manage detention centers who are really constrained by, the standard operating procedures that exist, but also really critically just by the budget allocations that are given to them. Often, and I think it relates to a question that was asked in the chat by Stephen. I think that the budget that is given to detention centers is incredibly low, and much lower often than what's actually allocated to prisons. And so, I think that the conditions are appalling, resources are extremely limited, and I think I have not actually heard of any examples.
Can I ask our other panelists? I wonder, Mark, I'm aware of there's obviously a huge diversity in the US of types of facilities that are holding ICE detainees, as I understand it, including in some cases county jails being called upon to act as effectively as immigration detention centres, as well as larger dedicated facilities. Across that variety, are you aware of, or are you seeing examples of at administrator level where people are acting to effectively mitigate some of the harms?
Well, I think so far, unfortunately, at that facility level, oftentimes the administrators have not been advocates for the detainees. But I think that there are ways that they could become advocates in terms of enforcing existing rules about medical supervision, for example. So for individuals who are requiring frequent checks because of health issues, it's been noted that, for example, that they have not been receiving that degree of observation, the hourly checks and supervision that would be important. So even just enforcing basic regulations for medical supervision would be a significant improvement, as well as rules about sanitation, enforcing ideas of sanitation for bedding, for hygiene, and now I think really for social distancing as well. Those are kind of the critical components there that that I think can help. And I think there's a little bit more oversight of those administrators in some of the federal facilities and accountability versus some of the private facilities where there is markedly less accountability and unfortunately more of a focus on cost cutting and saving money.
Mitsu, I think you might have.
Yes, I would like to thank you. I would like to comment that surely we understand the different countries with very strict legislations. But it's important for I think for the society to be aware that international standards such as the UN minimum standard rules for the prisoners, the Mandela rules, or Bangkok rules for the protection of the woman and the best interest of the children still apply to the immigration centers. It's not a hard law, but the authorities should take into consideration for the benefit of the people detained. Also, even during the times of COVID, the Penal Reform International has published and with clear recommendations from the pandemic lessons learned that visiting of monitoring bodies, for example, should not be stopped. Surely should be adequate to the health standards that is needed now, but it should not be stopped. And also, without mentioning specific countries, also some countries they are much more open, and that they with dialogue they are more open to receive visits in such centers. But it's really difficult, I think, to have a one common statement for all the contexts. They are so different and so complex. But I just would like to remind us for the international standards that they are there for a reason. Thank you.
Thanks, Mitsu. Joanna, did you want to make any comments? You somewhat addressed this in your presentation, but you may have some light to shed or some hope you can give us about local practices.
Sure. I think, as I mentioned, I think that digital connectivity has become very important for absolutely everybody all over the world during COVID-19. And we know that it can reduce social isolation to have chats with family or friends, community supports. So I think on a practical level, they should be helping to ensure that people have access to internet, telephones, smartphones. And I think that actually does go a long way, and also to try and restart visiting as soon as possible, not just to reduce the social isolation, but to, of course, increase the accountability, because that is a huge thing to have closed facilities that are privately run in Australia as well. And I think in terms of health, there's been, again, there's a lack of transparency about health access, and detainees need to initiate so much of the requests for healthcare themselves when they may not be in a place to do so. So I think that there needs to be mechanisms whereby you can have external second opinions and providers and things like that to improve the access and also the accountability measures as well.
Yeah, thank you. Some of the questions are raising a really good point about I'll turn to Stephen's question about looking at a comparison between criminal justice settings and immigration detention settings. and asking, why do you think that we're seeing, for example, a much more broadly implemented decarceration and broad large-scale releases from detention in the criminal justice space than we are in immigration detention settings? I'd be interested in your thoughts as to what's the underlying difference that the governments see that creates this sort of structural separation between these two groups. Anyone like to take that one on? Looks like Mark, you're unmuting there.
Yeah, well, I mean, I think certainly in the United States, one issue is that immigration can arouse a lot of different sentiments politically, and there is a lot of anti-immigrant sentiment in some populations within the United States. So, so I think politically it becomes an issue that may not be as straightforward as some of the policies on prisons. And unfortunately, I think some political efforts have moved towards really this idea that I had mentioned of using immigrants and infections in immigration centers as a deterrent for future immigration and to score political points, unfortunately. So it becomes a very different category than other detainees in the minds of politicians.
Can I ask our other panelists, do you agree that with Mark's point that that's a key driver? What's your comments about that?
I can mention, yes, surely this issue can be politicized, and it is by different actors. But I think I heard from all the panelists and the presentations, the security rationale is behind of all this detention. I think detention per se has this rationale behind. And then I heard also different aspects of the needs of the detainees or reasons for their trying to immigrate, access to health that they cannot have that, or etc. This is can't be dealt only with, for example, on the detention perspective, because it's a whole of government approach that it needs. We talk about, all of us, we talk about infrastructure. They start being detained in a place that is not a detention, which has no objective. And then it changes to another structure that can have a rehabilitation perspective, or not at all, or just security-wise. So it's just that it's impossible one sector of the government dealing with that. It's necessary. It is this opportunity to all of them to sit together, and because the needs and the characters are so complex and so difficult. I want to share. Thank you.
I'm happy to, I'm not sure if Joanna or Vivienne wanted to comment specifically on that to add anything else. I've got a lot of other questions, so if there's nothing burning that you wanted to add to it, I'll move on. But if you've got something that you'd like to contribute on that point as well, please do. A few of you have raised the fact that a lot of immigration detention facilities and health facilities within these are managed by large corporations, multinational enterprises. I'm wondering, how do you see these entities being held accountable for things like ensuring hygiene, ensuring safety and basic provision of health services? Do you see an effective framework for holding private administrators accountable in the immigration detention space? I'll put this one to Mitsu first, perhaps, since I know that
yes.
the ICRC.
No, it's really it's a must. It happens in immigration centers, and it happens in prisons, and it happens in jails, and in all the contexts. This is a long time ongoing challenge that even in 2003 WHO shared publicly that prison health is part of public health, that detention health services should be as close as possible to the national health systems. I can't I think it's not effective, let's say, that if we think about health and all the determinants of health, that includes social aspects as well, it's not about putting a clinic or just contracting a private medical provider, but how do we see the health of the society? So, promotion, prevention of health, it's beyond just the technical expertise. So I really, it's really necessary to that. This is why I think all the how can I say, all the actors working in with detention, including immigration, has always been encouraging that different institution, ministries, and actors, they should gather together because there are common goals, and I think that is more efficient, and we can have different perspective, but normally it's positive. It will be beneficial for everybody, for the population of surrounding prison, for the government with a different objectives, different ministry with different objectives, etc. Because, for example, the response to the COVID is a clear example. Some countries, the detention authorities, they are not really represented there. Maybe they are represented as part of the means of justice, let's say, in general, but means of justice has different things to do, and then not necessarily prisons or immigration centers are there. And then because how to tackle the COVID if the means of health is not there with their expertise, with their resources, or I find very difficult that we can deal with this effectively without a really whole government approach. So I really think that this COVID is just exposing all these chronic deficiencies, and is we need to tackle, because it's not possible to not tackle as a whole this issue. Thank you.
Thanks. Would anyone else like to comment on the issue of multinational enterprises who are administering detention centres and providing health services in those settings? Have you experienced with effective ways of holding these to account?
Sure, I'll jump in. I think we've got huge concerns with that in Australia, with private corporations running centres both offshore and onshore. Offshore, we've had 13 people die, and numerous from preventable illnesses or from completing suicide. And there have been multiple attempts at whistleblowing for corporations who are acting with impunity, as far as not providing adequate training to their staff, not providing a service to keep people safe in detention facilities, and a huge lack of transparency. So I think it's a major concern. It was prior to COVID, and the confidence of people in detention that they would be kept safe by these providers was extremely low, given that they already had so many concerns about how their treatment and the oversight mechanisms happening with private companies operating detention centres.
Really quickly, that I think that legislation in the United States could hold these kinds of corporations accountable, and that's really the only way. I think that there can be kind of a standardized way to enforce transparency. Right now, it's really left to investigative journalists so far that have exposed some of these issues.
I think I had seen reference somewhere as well to the GEO group shareholders actually bringing a lawsuit against GEO about alleging that the company had misled investors over the effectiveness of its COVID response, and subjected people to health risks. So this was something that one of our contributors to our global responses piece wrote about, and I found that really interesting as a means of trying to sort of curb some of the impact that these private companies do have. And yeah, I mean, I was actually going to ask Mark if he knew anything about that and his thoughts as well around, I think it was the Dignity Not Detention Act being one of the examples of legislation that would actually outlaw the private contracting.
Yeah, I mean, I think in the current administration, it's been really hard to really have any effective legislation, and it will still be a challenge given the balance of politics in the upcoming Congress. But I think we're optimistic that we can try to make some difference, and there are a lot of advocates in terms of organizations working on acts like that to try to see if the tide can turn. I think to hold some measure of accountability there.
Thank you. I think we may have a question or a comment from Natalie. Natalie, you may be our second last question, I think, looking at this. So please go ahead or comment.
Okay, excellent. Thank you very much. Good afternoon, morning, etc., everyone. My name is Natalie Deffenbaugh. I'm an advisor in the ICRC's unit for persons deprived of liberty, also based in Geneva as Mitsu, and with following immigration detention issues primarily. And thank you very much for giving me the floor. It was just primarily to complement what Mitsu and others have also said about the existence of standards to which detaining authorities and their subcontractors must adhere, and the fact that even more so for immigration detention, where it is almost exclusively administrative in nature, people have not been charged with crimes, they do not pose a threat to society, those standards are even more an absolute minimum. So it's not even a question of, it shouldn't even be a question of can they have phones or not, because what is the risk? There's not a risk of criminal conspiracy, which is, often the risk of restricting access to communications in a criminal justice facility. I could say a lot more on other topics, but we don't want to monopolize the floor either. Just to reiterate the absolute importance of not simply releasing people into a void, especially in the midst of a public health crisis, but to do so in a way that allows them to support themselves and does also take account of whether the grounds of their detention are still in effect or not. And so also needing to be able to distinguish and facilitate if people are still going to be required to attend hearings to do with adjudication of their cases, whether this is a provisional order to release them or an absolute order to release them, the kinds of questions that have been discussed elsewhere, but that are even almost even more important with respect to a distinction between not only regular, absolutely basic access to healthcare and shelter, food in the community, but then also these questions of whether and how their procedural safeguards can continue to be upheld. Thank you very much.
Thanks, Natalie. Great points. Yeah, that's really good intervention. We've got time, I think, for one more question. Just a quick one, and it's coming from one of our attendees who's asking, Vivienne, can you give some examples of the rights-based alternatives to detention that you mentioned? Which ones would be most likely to be feasible and practical given the immediate threat of COVID-19 in detention?
It's a tough question because I think that there's just such a broad spectrum of alternatives, and some of them range from, ones that aren't quite as rights-based. So for example, the release of people from detention into poverty. That would be not a good example, but then I think we've seen really good examples of holistic alternatives. And I think underpinning all of them really has been, we've identified as case management. So, having people be assigned a case manager who would actually support them through navigating the processes in the community, getting them access to legal aid, getting them access to shelter, to education, health. There are examples of these sorts of alternatives around the world. And And I think that's what we would like to, I mean, that's what we've seen through our research. These are the ones that actually achieve the most significant results in terms of well-being for people, but also things that governments are concerned with, you know, compliance, how many people have gone from programs like this. And we've seen from the research that it's actually very low. And I think, you know, what is a good alternative really depends on that national context, and the way that we have approached it is to really do an analysis of the national context to see, you know, what the laws permit, first of all. And I think the standards are absolutely there, they're critical, but when you're working with governments, you know, to try and change the system, the first thing they'll say to you is, well, look what our immigration law says. Look at what, you know, these laws say. We can only do what our laws say. And so you sort of have to do that analysis and try and find different aspects of legal systems that would actually support the creation of different systems. So it's also an analysis, I think, of what already exists in countries which have large numbers of undocumented populations. Often, you know, you'll also see that just resources aren't allocated towards actually finding a better way of managing populations in the country. And so I think often what we find is that governments also, they don't prioritize it, or they don't really know what else to do, because it has always been so I think it's also about seeing what civil society is already doing, what organizations are already doing to provide for migrants and refugees, and really using those to then kind of roll them out nationally and scale them up. But really, it has to be done in collaboration with government, and it has to be done in collaboration with civil society, I think, if we're going to really build strong systems.
Thanks, Vivienne. Well, that's all our time for questions. So I'm going to hand back to Stuart and just say thanks again to our panelists. Stuart.
Thanks, Louise, and thanks again to all our panelists. We are just about out of time, but I wanted to just very quickly invite each of our panelists to, if you have one sound grab, like 15 seconds, is if there's one message that you would like to convey to people who are participating in the webinar tonight, what would it be? And apologies for not giving you advance warning of this, and I'll go in the order in which everyone presented. So Vivienne, first for you.
I think it is that message that a few people have said about optimism. I mean, I think that there are a lot of horrible things that have happened this year in relation to detention practices, but I think we do need to focus on some of the promising things that have happened and try and figure out how we can actually sustain these.
Thank you. Thank you. Mitsu.
Yes, thank you. I think that the pandemic is really exposing really social chronic issues that is leading to inequalities and different health outcomes of the population. But personally, I believe that, let's say, crisis is an opportunity. And I think perhaps we have never been well equipped like now to deal with crisis. But perhaps it's not really an issue of technology or really science only, but just have a simple act as come together and talk and discuss and be open-minded. So I really hope that we go through this direction. Thank you. Sir.
Thank you. Mark.
Yeah, I just really love the focus on these issues being human rights issues. And I think we really need to take that to heart here in the United States, that when we assume responsibility for the care of immigrant detainees, that includes medical care, and it extends to the importance of protective and preventative care all the way to vaccination. So I really hope that we can continue to work on those issues from a rights-based perspective.
Thanks, Mark. And finally, Joanna.
I think that all of us can do something positive to support people seeking asylum and refugees in immigration detention, or those who've been released. So in Australia, there are not-for-profit organisations in every city and state who are providing material welfare, who have volunteer opportunities, who are visiting people in immigration detention when they can, to have a cup of tea and connect on a very human level, to make people know that while the system may be oppressive, there is human kindness and connection out there.
Thank you. And I don't really have much to add to that other than to say thank you once again to our 4 fantastic panelists. It's been a fantastic conversation, and I'm very grateful for both your expertise and your message of hope and positivity to achieve better outcomes. Thank you also once again to everyone who's decided to take part and listen in. We do have 2 other webinars coming up in the coming months. Please check our website, follow us on Twitter to find those the dates when they're announced for those. Once again, thank you very much, everyone. Be well until we see you next time.